Hi, I'm Sarah White, Director of the Campbell County Drug-Free Alliance.
And I'm Shannon Gilley. I'm the chair of the Campbell County Drug-Free Alliance.
And we are here today at the Mobile Syringe Access Exchange Program. And we are just going to give you all a little guided tour of what a mobile unit looks like and interview a couple different people so that you, the community, have a better understanding of what an exchange program is and what it looks like.
Well, we're here with Dr. Lynn Sadler from the Northern Kentucky Health Department. We have a couple questions that we'd like the people of Campbell County to get some answers on. The first is, what is a mobile syringe exchange access point and why is it important for the community?
So a mobile syringe access exchange program that we're operating in Newport and in Covington starting next week is an opportunity for people who inject drugs to come and receive some healthcare services. Part of that includes exchanging contaminated or used needles and syringes for sterile ones so that they don't share equipment and they stop the spread of disease in the community. And then also we're offering training and Narcan overdose reversal kits so that we can try to stop the number of overdose deaths that are occurring in Northern Kentucky. And then we're also offering instant HIV tests. So within 60 seconds you can find out if you're infected or not. And if you are infected, we can connect you to the services you're going to need to stay healthy.
Well, thank you. And if someone wants to access these services, where do they need to go?
So the Mobile Syringe Access Exchange Program will be operating in Newport on Tuesday afternoons from 1 to 4, and that is at the St. E Urgent Care in Newport up near Fort Thomas. And then on Thursday afternoons from 1 to 4, we will have the mobile unit here in St. E Covington parking lot.
Great. Is there anything else you need the community to know about the mobile exchange? Any other questions that people have asked that you would like to answer?
I think what people should take away from this really is that as public health practitioners, we're trying to do our jobs of stopping the spread of disease in our communities. We want to get those used needles and syringes out of public spaces because we don't want our first responders or our kids or the general public to get accidentally stuck. So we want those brought in and exchanged. And then we also want to help people get into treatment for their substance use disorder because that's just so important for their health and being able to become productive citizens.
Great. And so my last question is, if someone needed to go to the exchange, what do they need to bring with them the first time?
So anyone that wants to participate in the program really just needs to bring in all of their used needles and syringes, and that's really it.
Great. Well, thank you so much for talking with us.
Hi, again, my name is Sarah White with the Campbell County Drug-Free Alliance, and I am here with Dr. Howard. I will let him go ahead and introduce himself and give a little more information about the Syringe Access Exchange programs. Dr. Howard.
Well, Sarah, thank you very much for the introduction. Again, I'm Dr. Jeff Howard. I'm the Commissioner of the Kentucky Department of Public Health, which exists within the Cabinet of Health and Family Services. I'm here today where we're seeing the Syringe Exchange Program initial outing. What is fascinating about this and what I'm so proud of this community for is they've adopted a syringe exchange as part of a comprehensive harm reduction program, but they've done it through unique partnerships. One thing that you may have heard me say over and over is we got to produce better health outcomes for Kentucky through better partnerships. And in a partnership with the St. Elizabeth Hospital System, as well as the Kentucky Fire Commission of all folks, the folks here in the Northern Kentucky Health Department have been able to establish these partnerships to be able to deliver needed services to their citizens, which is just simply amazing, and I'm so proud of the efforts that they have brought forth. You know, what's important is that we continue to destigmatize substance abuse disorder. It truly is a disease that incapacitates a person's neurologic systems, hijacks their ability to think at higher levels, and makes them act in ways they normally wouldn't. And we need to view it as that sort of disease, Sarah. And I believe that operating harm reduction programs are part of a comprehensive package that can help decrease the amount of substance abuse that we see in our communities, as well as decrease the amount of diseases that are a direct result of substance abuse. For example, by switching dirty syringes for clean syringes, we see less infectious complications of substance abuse, which can be very costly and devastating to the individual, as well as our communities and our states. I'm just so proud of the folks in Campbell County for having this difficult conversation and ultimately making a decision that they believe was best for their citizens. You know, Sarah, I don't think syringe exchange programs are necessary for every community. And I certainly don't want to advocate or push syringe exchange programs onto communities who are not ready for that decision or it's not right for them. But what I do want as a state health commissioner is for our communities to have that conversation. It's not okay not to talk about it. And if you decide at the end that it's not right for your community, that's okay. But these folks here decided it was correct for their community, and they're doing a fabulous job of implementing a new program that I truly believe will decrease the incidence of substance abuse, will decrease the incidence of complications of substance abuse disorder, and will improve the overall health of their citizens.
Hi, I'm here with Stephanie Vogel, Director of Population Health. And as you know, this syringe access exchange topic is kind of a hot topic right now here in Campbell County. So I was just wondering if you could address some of the misconceptions that surround syringe access exchange programs.
Well, thanks for having me, Sarah. I think, one of the things that we hear a lot in the public and from community about the concerns with syringe access exchange programs is that they're going to enable users, whether that's to start using injection drugs or to use more, that it's kind of that permission for them to be able to do that. So and we know that that's not necessarily true. You know, folks do not start injecting heroin. They usually start with another substance or start even with heroin and using it in another way. So us providing clean needles and clean injection equipment for folks is not going to be the impetus for somebody to start using injection drugs. And we also know that it's not going to help them use any more. It's not going to make them use any more than they already are. We know that folks actually around the country for syringe exchange programs that operate, that we see that participants will actually end up using less, injecting less, and that probably comes from a lot of the education that the folks on the unit are able to do with participants and provide them with information about safe use, and also consistently talk to them about access to treatment services too. And so it constantly puts that plug in their head that, you know, you can seek treatment and it can be successful for you and you can recover from use. So that's probably the number one thing that we hear about syringe access exchange programs. And the other thing that concerns a lot of folks too is that it's going to increase crime in the area. And that historically from the many programs, you know, there's well over 200 programs operating throughout the United States. And that's not what the research shows us either, that crime does not increase in the areas around syringe access exchange programs. It many times will be reduced because there's more people on the street kind of watching the program and seeing what's going on. And then also people have a place to discard their dirty injection equipment. A lot of times our programs are offering sharps containers, and so that allows another safe disposal of equipment. And so a lot of times you see a lot of less crime and a lot of less dirty needles and injection equipment around the area where the programs are operating.
Thank you so much, Stephanie. We value what you do here in the community and what the health department and with the partnership with St. Elizabeth is also providing for the community of Campbell County. Thank you.
Hi, I'm Pamela Millay. I'm the Director of Clinical Services at the Northern Kentucky Health Department, and we are here at our syringe exchange program. And I'm going to tell you a little bit about it. So this is a mobile unit, which we actually had donated by the Fire Commission, and we are basically running a needle exchange program. So the purpose of the program is to reduce the spread of infectious disease and for harm reduction to the individuals who have this disorder. So if you want to take a look at some of the equipment that we are exchanging, we are exchanging needles with the individuals. It is a one-to-one exchange. We ask them to bring equipment back. And then we also give them sharps containers. We have materials here regarding hepatitis C. We have about wound prevention and care, HIV as well. Of course, there's syringes, which we exchange, but we also give them gauze pads and alcohol swabs and cotton filters to use to get impurities out of what they're using. So the purpose again is harm reduction, to keep them healthy and not spreading disease. So we also give out Narcan, which we will give out to family members, to individuals who, we give it out in our health centers to anyone who feels they need it. We also do HIV testing, and we have this Insti test, which is it takes about 1 minute to run, so it's very quick. Our hope is, because the previous test took 15 to 20 minutes, our hope is that because it's a 1 minute test, more people will choose to get tested. If we find they're positive for HIV, they have any symptoms that we think need following up on, or they actually ask us for assistance or referral to treatment, we will provide all that as well. In the mobile unit, we will not have it available in here, but we will refer them to who they need to get to. Any positive HIV test, we have case managers who will get them into care. If they have a wound because of their drug use, we will refer them for treatment for the wound. It is quite exciting for the Northern Kentucky Health Department to be doing this.
Hey, we're here with Gary Blank from St. Elizabeth, and we just want to ask you, Gary, what does it mean for St. Elizabeth to be involved with this program, and what are you looking to get out of it for the community?
I think St. Elizabeth has been very involved from the health of the community perspective. If you look at our vision statement, it's to help lead Northern Kentucky to become one of the healthiest communities in America. And when you have such a scourge that we have in our community related to substance abuse disorder, IV drug use, and heroin abuse, the disease that's potentially to be spread, hepatitis C, HIV, others, really can have a devastating impact on the health of our community. So we feel passionate for us to achieve our vision and our mission. We have to really take a forward stance on this to really try to bring disease prevention to our community. It will help on one aspect of it. It doesn't help in the total issue that we're dealing with around the HIV and hepatitis C and the heroin abuse, but it's one component that allows the other pieces to work. Also, what we've been able to find is when you have a syringe access exchange program, you have about 25 to 30% of those individuals coming to the programs that eventually end up in treatment. And that'll be a big goal for us as well, to get people into that next level of care to help break the cycle on the long term.
Great, thank you so much.
So thank you for taking this tour with us. This is something that the Campbell County Drug Free Alliance supports, and we are very excited for this partnership with the Northern Kentucky District Health Department and St. Elizabeth, providing a service like this in Campbell County. So if you find yourself in need, or someone that you know, please do not hesitate to come up to the Syringe Access Exchange mobile unit. It is located in Newport by the St. Elizabeth Urgent Care. This is such a wonderful opportunity for our community. Let's take advantage of it, and let's get better.